webinar. Welcome everyone. If you could put yours on mute. I see most people are doing that. Thank you. Okay, well, welcome everyone, and I am Carrie Hopkins-Isles. I'm the Deputy Director for ICU DDR and the one who sends you all those fun newsletters and announcements. And I just want to take a minute to welcome you. And of course, as you know, the ICU DDR is the International Consortium of Universities for Drug Demand Reduction. And one thing I want to point you to is that we have our new website, which is icuddr.org. So if you go to our old website where you maybe have gotten information in the past, it should send you to our new one, but we're working on getting that to be automatic. So in the meantime, you'll see that on the homepage of the website, we do have an announcement about our conference in July. So this July from the 13th to the 15th, we're going to have our next conference in Bangkok, Thailand. And the registration will be up there shortly. So do make sure you're checking out icuddr.org. And with that said, I'm going to turn it over to Dr. Peters to introduce our speakers. Thank you.
Jerry, and welcome everyone to the webinar. Today, I think we have an exciting program today, and I want to introduce our speakers, and we'll proceed. So again, the title of the webinar today, as you know, is Academic Programs in Drug Treatment and Prevention at Paraguayan Universities, Implementation of the Universal Prevention Curriculum and the Universal Treatment Curriculum. So I think we're in for an exciting program to hear about how academic programs are implemented using these two curricula in Paraguayan universities as an example. So to start off with, we're going to hear from Diana Lesme Romero, a psychologist, professor at Catholic University in Asunción, Paraguay, and former chair of the Department of Psychology. Also, she's a member of the board of directors of the ICU DDR. Also, we have with us today, I'd like to welcome Cecilia Munoz Perez, who's a psychologist and also a professor at Catholic University in Asunción, Paraguay, and Graciela Barreto Castro, who is a psychologist and professor as well at Catholic University. And in addition, she serves as General Director of Drug Demand Reduction for the National Anti-Drug Secretariat in Paraguay. So welcome to each of our speakers. And at this point, I'd like to turn it over to Dr. Romero.
Thank you, Roger. Thank you, Carrie. Good afternoon, everybody. Well, for us, it's afternoon. It might not be afternoon for everybody in different parts of the world. I would like to start by thanking the ICU DDR and especially Dr. Roger Peters, Carrie Hopkins, and my colleagues from Paraguay that are there at USF for this opportunity to talk a little bit and share what we're doing here and what we're finding to be our programs in drug reduction in higher education. So with that having said, I would like to start talking a little bit about our country, because I figured that to talk about programs that are being made or implemented in the country, you need to know a little bit about Paraguay. I don't know how many of you know a bit of that. So I'll go over to our first, sorry, to our first slide, Carrie, please. Our first slide where we have some information about Paraguay. Are we there? Can't see it. Let's see. If you're seeing it in your computers? Yeah, there. Thank you. Well, if you go to the first page, to that one, can I do it from here, Carrie? I apologize. This is the first time I'm presenting in a webinar, so I'm trying to get the right instructions to do this. The following one. Next one.
Next one?
Yep, please. Just a presentation. Didn't change.
Okay.
The following one. That one, yes. Well, a little bit about our country. That's a map of our country. We are surrounded by Brazil, Argentina, and Bolivia. Our population is a little bit over 7 million, according to projections made in a few years ago. 70% of our population is under 30 years old, which is very important because we have a lot of people that are in the age of taking higher education classes and doing a lot of things for the country. The poverty index is now, it was in 2014, almost 19%. The health coverage is a little low. We have 26% approximately. And that it has to be said that especially that is true for the urban areas, more likely. In the rural areas, there's less coverage in health, basic health care issues, services. With internet access, however, there is a lot more people that have internet access, and that's almost the same in urban and rural areas. And if you see at the following figure, there is almost 100%, 96.6% that has a mobile phone with access to internet. And that is how there is almost a general coverage of internet in the country. The literacy rate is at 94% now after a few years of working in that with the Ministry of Education has been working on that. Next one, please. That's a little. In regard to the problem of drug use in Paraguay, the main problem I think we have many problems as in any other country, I suppose, but one of them being the scarcity of systematic and statistical data available in the general population about what is the drug that is most being used, what are the disorders that are, what are the treatment available. We do have some data, but there is no such continuous feeding of the data available. So we have data that could be like from 5, 6, 10, 15 years ago. We're now producing year by year or every year at least enough information. So we face that kind of problem in terms of deciding what kind of programs we need, where, when, with what population. We could have more. That's one of the challenges actually, and it has to do a lot with the universities, because universities are places where there could be a lot more investigations, research about the problematic. But there's little still. So we're working on it. We're trying to motivate academics, professors, people that are around the academic setting to get involved in this specific topic. In general, there's little research made by universities and by society in general. In the area of academic addictions, drug demand reduction, there's even less research. So that's one of the main problems. However, we have some. I will show you in the next slide one of the studies that was made in 2014. We could go to the next one, Carrie, please.
Yes, and I just want to take a moment to remind everyone to please put their computers on mute because we're hearing some background noise.
Okay. That study made in 2014, as I said, is lifetime prevalence of substance abuse among secondary school students. And it's helpful to see what kind of problems we have, although 6 years old by now, but still is a sample of what we have. where you can basically see that our biggest problem in terms of legal drugs is alcohol, followed by tobacco, and then comes some other tranquilizers and marijuana and stimulants, cocaine, crack, and ecstasy, and other type of drug use. And there is a very slight difference too between male and female populations, and this in this study of 2014. 56% and 61, not a big, in terms of alcohol use especially, that is our biggest problem. They start very, very young. That's why this study was made in secondary students, and they start very early to have alcohol use and abuse. Next, please. We can also see, and we know that the highest prevalence of substance use, as I said before, is alcohol among the illicit substances, and among the illicit substances, marijuana. That was from the student population research made in 2014. We also know that the highest prevalence of consumption among people between 15 and 39 years old. Is 83% is the prevalence. We also know that 56% is under age 30 of those who are abusing of substances, according to that study mentioned there. And we also know as well that the type of drugs that motivate the demand for treatment in the treatment centers, the very few that we have, in 2012, according to that agency, was crack among the illicit and alcohol among the illicit. So those are some of the very few data available that we have. And as I said, it's not always updated as I would wish it could be, to have a more real picture of what is the situation currently. Can we move to the next? In terms of treatment addiction, of addictions of disorders produced by abuse of drugs, Paraguay has a network of public health system establishments responsible for healthcare populations. They're called family health care units, and they're based in that APS program, which in Spanish is Atención Primaria en Salud, primary health care. And they are all over the Republic. We have 17 departments. The whole country is divided in 17 departments, 17 areas of regional areas for public health providers. Not always are included there the treatment for addiction, not their general treatment centers, not necessarily for substance abuse, but for other type of disorders, mental disorders, other type of disorders. However, in those centers, there are some treatment and rehabilitation services, such as among the services that are provided in general, early detection of drug use, I should say, guidance and brief intervention, and then basically referring those people affected by drug use to treatment in public and private health services. They refer to more specific services, which basically is the Centro Nacional de Prevención y Control de Adicciones, which is the National Center of Addictions Prevention and Treatment. We have one that depends on the public system and is located in the capital of the country. That is the other concern that we have in terms of access to resources for treatment. Many of the people that need to get services and treatment and live outside the cities or either the capital or other important cities in the country have some difficulty in getting access to those centers, because not in every healthcare unit there is a professional trained to provide those services. So they provide general services, and they might or might not be trained specifically in those type of situations related to disorders or problems that have to that come as a consequence of drug abuse. So that is an issue in terms of what we're offering. And I want to make call attention especially to the point that not in every health service we have trained professionals, or there's another category of called health operators that are people who not necessarily have a university degree, but they are working there as technicians, and they might have some basic, very basic training, but not the specific one. And that's what we want to point out, because the whole point of this presentation is also taking this into account to show the need, the real need that we have of these programs of the UPC and UTC to professionalize the workforce in Paraguay in general. Let me move to the other one. That is a list of professionals working in treatment centers and support self-help groups like Alcoholic Anonymous, Narcotic Anonymous. By 2012, in terms of percentage, there you can see that there are more in the private sector than in the public sector. And we have some of those professions that are related to these services are coordinating staff, toxicologists that are, by the way, general toxicologists that will work in cases of overdoses, but they're also more, we'll see then, when we see the programs of the universities and what they're offering, what they're receiving from the universities, either in medical school, nursing school, psychology school, by toxicology is more from a clinical point of view, clinical and general point of view, not necessarily directed or addressed to work with drug abuse or overdoses. So those are toxicologists. And then we have therapeutic operators. We have also occupational therapists, nurses, social workers, nutritionists, doctors who work with infections that are called infectólogos in Spanish. I'm not sure that's the same word in English, the work with infections. General physicians, educators, psychologists, and psychiatrists. So you can see that in the first part of the numbers, basically the human resources are concentrated in the private sector, not in the public one. And starting with the therapeutic or occupational therapists, then there's some still less in the public sector, but there's some, which is good news, because there is where people who need the services could basically go. Because the private services, the healthcare private services in Paraguay, as in many other parts, I believe in Latin America and other places, are very, they have high cost if you are going to go with private services. They have a high cost. So people will get most likely to the public services in terms of economic cost, financial. We move to the other one, please. This is a list of what we don't have in Paraguay. Then we can move to what we have. We have, according to this multilateral evaluation mechanism with the Inter-American Commission for the Control of Drug Abuse, CICAD, and the Multidimensional Secretariat, we have no instruments in Paraguay to monitor accreditation of treatment services and centers, which is a real challenge that we need to take into account, and we need to do something with it. No national mechanisms to verify the compliance with the standards of care or quality of drug treatment services. No formalized system to monitor operation of drug treatment programs. So they are monitored by the people who are in charge, but there is nothing like a national or regional monitor system that could verify the progress of the treatment programs. No accreditation process for the drug treatment centers. And then that has to do with the accreditation of how is the accreditation of careers and universities in Paraguay that we're going to discuss later on the presentation. It has to do with how that is being done. So these are the things that we don't have. And then we're going to move to the things just to cheer up a little bit, to get a look at things that we are doing with what we have. We develop a minimum standards of care for patients with problematic consumption of alcohol and drugs. But that has to follow us in any other country, I suppose, a bureaucratic path. It has to go to several agencies of the government to get it, formalize it, and publish and get it for every center that is treating in Paraguay. But we do have developed a list of minimum standards. The National Center for Addiction, which I mentioned before, is the main center of the public sector that is doing the treatment, has a protocol of assistance and treatment, which is not officially approved by the Superintendency of Health, which is the highest instance of the Ministry of Health that has to approve the protocols of assistance and treatment. There has been some movement in the politics as well, and that only get the processes slow, and I think that's one of the reasons why it hasn't been done yet. And maybe because also the problem of drugs is not a priority in the agenda of the government. And so far, although we do have a plan of action, 2017-2022, that was approved just in 2018 was approved, so we have that now. And part of the plan of action, which is from the government, it gets us enough input and enough motivation to make things happen. Like for this protocol of assistance and treatment, we have to move and get in a hurry so that these protocols of assistance gets approved, because they're working basically and functioning with that so far. We also have some continuous training for staff working in that National Center of Addiction, because they have a department called Teaching and Research and Training. So they do their own training, but there's nothing like state plan policy that will enforce them to get the continuous training. So they have their own plan, and they move on the training as they feel they should do it. In fact, we have been doing a few actions, a few programs. And when Dr. Peters visited that in August 2017, he visited the center and also the Senat, which is the National Agency of Anti-Drug, which is the other agency in which some training is done for people. So there's something going on there too. Senat, through the Demand Reduction Department, offer trainings and guidance to instruct institutions and professionals of the public and private system. Universities, however, which is our main topic of this presentation, do not have systematic nor specific educational training programs on the subject of substance abuse treatment prevention. In some universities, what we found, what I did is I did a review of everything that's been offered, academic offers, in terms of drug demand reduction, substance abuse, addictions, in the webs of the University of Paraguay. And you will be very interested and fun to see what I found. But basically, I found that there is no one program that will certificate persons as addictology. I heard there's some countries that have those kind of formal programs that you can go to school and get your certificate or you graduate as an addictology. But we don't have anything like that here. So we have no career formally established to give you such a training. However, the subject of treatment and prevention of drug-related programs are part of the topics or some contents in some areas and some subjects, mainly in the schools of medicine and psychology and nursing, some of them in nursing, but basically in medicine, most likely, and some in psychology, very, very, very few. But it's only either a subject or less than a subject. It's a content in a subject that it may be called psychiatry of clinical psychiatry or mental health or forensic psychology. Those are the kind of things that I found, and I will share with you later on the presentation. So just to mark down that we don't have many things, but we have some things. In terms of normative framework, that is also important to know what is that we have in the country and how we can move forward the programs, the trainings in the area. Paraguay has a national anti-drug authority created in 1991, which is the National Anti-Drug Secretariat. It's called Senat. It's known as Senat, Secretaría Nacional Antidrogas in Spanish. And we work together in terms of policies, in terms of trying to get cooperation in defining big lines of training. But there isn't a history of a long time working with the University of Senat. It has been, we have this difficulty that it has been seen or understood as an agency that works basically in repression, not in education. So it's not long that we have started to work with the agency in terms of we can do things together, and we need to know what are the general policies, what is the reality in the country, what are the data that you had available, and also from their side, it was also you guys at the university had so much to say about this. You can do researches, you can do lots of things in training the workforce that we need to work better in the services that we provide. So we had some efforts together with universities, with the Senate. And then there's that national policy on drugs of Paraguay that I was mentioned before. And specifically in one of the goals it's a very long document that I'm not gonna talk about the whole thing, but I'm just rescuing or emphasizing this one goal because it has to do with the presentation. Under the goal promotion and strengthening of the capacity of the authority on workers, such as health and education, they have specific goals again, sub-goals. One of them being incorporation of drug treatment and prevention to the curricular degree of 3 schools. They especially talk about or wrote about these 3 schools: medicine, nursing, and psychology, which is exactly why I did a review of those careers, because that is what is in the national policy, with the goal that at least 3 universities make additions to their curricula in the area of drug treatment and prevention. And the second goal they had is promote the creation of postgraduate program for physicians and psychologists and technical training programs also, which is called tertiary education, which are not necessarily university, doesn't give you a university degree, but it gives you technical training. That was another goal, promote the creation of those postgraduate programs and technical training programs at tertiary education. So under those, we have now like a guideline, or we have the emphasis that we need to go back to our universities and say, hey, we need to do this because this is part of the national policy, is the priority. They're hoping at that we can produce and do this and help with this, which is a problem for the whole society. So that is certainly help a lot that we have now published this National Policies on Drug of Paraguay 2017 to 2022. Come on. Now, the other thing we need to mention as well, how is the situation, the university situation, not only in Paraguay, but in Latin America, just a little bit, just to get kind of the context in which we're moving. According to the World Bank, an investigation published in 2017, 50% of the students accessing higher education in Latin America succeed in completing university studies between age 25 and 29. And the other portion, the other 0.5% or 50% did not conclude it. Now, some because they have to work, they have to get into the work market as soon as possible. And others because they continue to, they would like to continue working for a postgraduate. And so they would like to complete as soon as possible, but they don't get to it. Because of opportunities, maybe they don't get the career that they would like or the program that they would like to do in where they live at, their zone of residence, because that is another problem. In Paraguay, we have a pretty sad, I would say, situation. If you look at the box, at the pink box, according to an NGO that works with topics of education, especially in higher education, in 2017, they got this statistic together, which says that of every 100 students who begin their primary education, only 35 would culminate in high school. And of those 35, 10 will begin higher studies. And of those 10 that begin higher studies, only one of those will finally achieve graduation. This is really sad. I think it's really sad. It's a statistic that applies for the whole country, and that might be quite different if we compare like reality in the cities, like in urban area, where they're concentrating many more educational programs as compared to what kind of programs and universities they have established in Paris. However, it's a sad situation. And the story of how universities come together in Paraguay, I always mention this as an historical issue that determines somehow why we didn't have many, or we don't still have many education opportunities. In Paraguay, we have a quite hard dictatorial system for 35 years until 1989. And under those years, universities were not well seen because, you know, universities teach people to think and to promote and to rights and do things for themselves and progress, and dictators don't usually like that. So what we have under that period of time, which is why a whole lot of time, we have only two universities. The National University of Asunción, which was founded in 1889. That's the first university in Paraguay. And as it is named of Asunción, you can figure it that is located in a capital. There were no branches, no other programs in the rest of the country. And then the Catholic University, which is where we work, Cecilia and Graciela, which are there, and myself, work at the Catholic University, was founded in 1960. And it was founded because it came from the Catholic Church, and Paraguay is a very Catholic, in terms of general, still very Catholic. So that is how the university was founded. But then after there was a change of government in 1989, as I mentioned, and then there were so many universities founded. Between 1991 and update now, we have a total of 54 universities. Only 8 of them are public and 46 are private, which also calls attention to another issue. Universities, it seems like to be a big business. You know, there's a lot of, you can sell a lot, you can gain a lot of money, it seems like, because there's so many private universities everywhere. And only 8 public. Which leads which would lead us in another direction that we don't want to address right now, but just to point it out that it has to do with the business of education, as in many countries. I know last decade Chile has had a lot of discussion about, and a lot of social movements and riots about this issue, that education is a good that should be accessed by public, by everybody, to have an opportunity to go to university, which is clearly not the case in our country with those numbers. According to a researcher called Cigarribia, up to 2013, of those 54 universities break down in 288 schools, different schools in different areas, which is at the same time they break down in 1633 careers. So we do have a lot of careers, a lot of schools in Paraguay. We can move to the other one. In terms of education, which again, the normative framework, this is what we have. We have a lot of universities in 1993 Then we have a National Council of Higher Education. We replaced the law of the university, which was created in 2013, which is now the National Council that approves the programs and gets the permission for a university to start providing services. And in 2003 was also created, founded, the National Agency for Evaluation and Accreditation of Higher Education. It's known as ANEAES. They started to work to accredit universities and careers, but for some reason, our law provides that the system is that the universities are not accredited, but the careers are accredited, not the whole university. So a university could be legally established, but have some careers that may or may not be accredited, because not every career is also accredited. It's not compulsory. The accreditation is not compulsory. It's only compulsory for those careers that grant qualifications that enable for the exercise of those whose practice may mean, that's specifically what the law says, may mean damage to the integrity of the persons in their patrimony. So under that, they included medicine, nursing, architecture, dental care, engineering, and that's about it. So the first big group of university or careers, that needed to be accredited, or which was compulsory, was those careers. Neither psychology nor social work were included in that list. But now the good news is that there's a call for accreditation of psychology was made this January, just now. January 6th was called, so I guess we're gonna have to put together the criteria of quality to get accredited by the ANEAES. So that's a good news, because it's certain grants, a certain conditions of quality, which we did not have before. So that's good news. And among that, in that reality, we have 3 official education providers of the university curriculums in Paraguay, UPC and UTC. We have the Universidad Católica, the Catholic University, which was founded, as I mentioned, in 1960. We have also the Universidad Tecnológica Intercontinental, UTIC, founded in 1996. And we also have the Universidad Metropolitana de Asunción, known as UMA, founded in 2003. So those 3 universities are the ones that are following the processes and did an agreement with the Senate and with the CICAT to provide the services of careers and courses with the universal curriculums. You can move to the following. Am I going too fast, too slow, too boring? Any insights? Okay? Are we okay?
Most people are muted at this point, but from my perspective, you're going at a good pace. We're getting all the information and you're following with the slides. I don't know if we want any questions or if you want to continue.
Wait to the end. Thank you.
Okay. Okay, so I'll go on, and then if there are questions, then we can see them after. Okay, we're going fine? Okay. Okay, a little bit of the background now. If we're going to go to especially the training in substance abuse at the tertiary level or higher education, there are some intents or some background, some motivations that people had in the past, because this is a need that we felt we had to have a long time ago. And so we're really happy now that we have the opportunity to provide these services in our careers. In 2005, 15 years ago, the Ministry of Public Health and Social Welfare granted accreditation to a group of people as therapist operators. That was the only, it did only for a few months, I guess. It wasn't a program that was continued, and after it was just a group of people and then discontinued for some reason that I'm not aware of. Again, in 2009, another course was offered, which had 450 hours by the National Institute of Health in agreement with Universidad del Sol, I guess. Graciela Barreto, who is there, I'm sure she has more information because she was the one who designed the project and actually make sure that that was done. So I will ask if she could give us some insight. What I know is that of that first group of specialists in treatment, that was the certification they got, there were 72 applicants, and 69 completed the course. Could you, Graciela, give a little more insight of what you guys prepared at the time, and what were your goals, your ideas with the translation? Ceci?
Sí, entonces, yo le voy a decir despacito. No, era el tema en el Centro Nacional de Control de Adicciones, en cooperación con el Instituto Nacional de Salud. Entonces se realizó un curso de especialistas para tratamiento de adicciones, que fuera la malla curricular, digamos, fuera certificada por la CICAT OEA, también por OPS Paraguay, y nos apoyó también en una de los módulos la Universidad Católica. Y principalmente era para profesionales que estaban trabajando en el tema de los tratamientos.
So along with two public institutions, they worked with a program that was aimed to to professionals already working around health issues, and it was recognized by the Pan American Health Association. And yeah, it was successful, although it only had that one opportunity to be presented.
All right, thank you. Thank you. I just wanted to give you guys, who you're listening to this presentation, a little more information on how the intentions and the motivations were there a long time ago, but it wasn't until recently that we had the opportunity to crystallize and really do these courses more with more access to people, with more professionals that came to cooperate with us and help us with the trainings. All right, I guess we're ready for the next one. So now comes the little review that I did. What are the Paraguayan universities offering in the area of substance abuse? That was the leading question. And what I did, I have to tell you that I only checked the website. I didn't make personal contact, except with the university. There are educational providers that I made personal contacts. The rest, I just saw what they're offering in their website. See what is that they're offering. Where do we need to put more emphasis? What kind of insights could I get from the programs that are already in place and being offered to the population? And what I found, let's move to the next one, please. For careers, I reviewed the 3 careers that I told you before, I mentioned before, that were in the actions proposals in the National Policy of Drugs of Paraguay. they were saying that they hope that these 3 careers will include some kind of contents about addictions, although they're already doing it. So I checked those 3 and I added social work just to check if there was something more that could appear in those programs. That's what I did. Let's move to the next one. I had some limitations and obstacles in the analysis of what I found on the web, mainly because most of the offers are at grade level, some very few postgraduate offers, but also because the information is either not available on the website or it was incomplete. So not all of the curriculum or the plan of studies of every career was published in their webs. So that was the first problem. I figured that if I was a person that wanted to take one of those courses, would like to know what is that I'm going to be getting when I enroll such and such a course. And not always you could get the information. In some, you will get information, but and in others, it was fairly incomplete. In many cases, what I found, and this is very interesting in our country, although it's not a surprise, unfortunately, I have to say, there were also many discrepancies between what the careers or the universities, I should say, are legally enabled by the agency that is the CONES, which is the agency of higher education that gives the universities the authorization to work. So I checked with the website of the CONES as well, and there is where I found the discrepancies. Those who are published there, those careers are published there as legally enabled, and those careers that are offered on the websites of the university. And this opens a question, ethical questions of whether the careers are indeed legally enabled or in the cases that have been accredited in the country, are they accredited? Are they legally, formally established? And I mentioned before, with sadness, I have to say that this is a country in which there's a certain level of corruption and in all levels of society. And it wouldn't surprise me that some of these careers that are published and offered as academic offers in the web of the universities are not legally established or published. But I can't say, of course, I can't say that is the case because I will have to prove it. But it just called my attention that there was so many discrepancies between what they have been enabled to do by the CONES and what they published, they offered. And another relevant, I don't know that this is a limitation, but it's just a clarification that I'd like to make in regards to the numbers that you're going to see soon, is that their careers that I check are offered in several cities of the country, not only in Asunción or other main cities of the country, which, and this is another surprise, this is indeed a surprise, that sometimes the same career offered in different cities by the same university have different plans of studies for the same career. Which means that if you started your career of, let's say, nursing in Asunción, and then you want to move to, I don't know, Kawasu or any other city, you may have to take over some subjects because the plan of studies is not the same. Even when you go to the same university, which branch is located in this other city that I mentioned. So that's kind of surprising in a way, but it's also part of the whole difficult system that we have at the universities And that is why exactly we need to move forward the systems of accreditation and certification and have more control on what is being offered to the population. This is what I found undergraduate and postgraduate programs in the 4 careers. Remember, in the bottom, there's a little box in which I'm remembering what we said, or this man, Estigarribia, said that we have available, or we had until 2013, 288 schools and 1633 careers. So keeping those numbers in mind, it's surprising that we only have nursing careers. We have 29 only. We have 26 of psychology, 21 of medicine. Universities that don't have any of those careers are 7 universities that most likely have careers in the area of business or engineering, business, computer science. And social work, I found 7 programs that are offered. So that seems to be quite few if we take into account the number of total careers, which is not even updated. It's 2013, we have 1633, probably 6 years later, we have more careers functioning legally or illegally in the country. So we have very few undergraduate programs that have those 4 careers. And under postgraduate programs, I found another career called public health, which is not part of the psychology, not part of medicine, nursing, or social work. It's a different career called public health. And I found actually is the career that has more offers to a postgraduate level. I found 12 of those, 11 of psychology. I found 4 in medicine. I'm sure there's more, but I'm saying that one of the limitations is that what they put up in their web. This is what I found. Nursing, I found 1 in postgraduate, and social work, I found 1 as well. So by looking at those numbers, I can't avoid thinking, wow, we have so much work to do. There's so much to develop, so much to work on academic offers in those 4 areas, and especially in terms of what we want to offer in terms of substance abuse and drug demand reduction offers. Next one, please. I also checked. Yes.
Dr. Peters, just very quickly, we have just a half hour left. Maybe you can get to the implementation of the UTC and UPC.
Sure.
Can you finish up?
Sure. Can move to that. Let's go. We can go one more. Let's see. No, go to the previous one. I would like to show that. Not the previous one. That one. Yeah. Some of the previous findings that I would like to share. What is that I found in this careers is that I found some subjects like pharmacology, toxicology, and that's about it in terms of what is in their curricular plans. Contains of pharmacology, including pharmacodynamics, mechanism of action, pharmacokinetics, collateral damage, interaction, drugs to be applied for treatment of clinical disorders. And one of those contents usually is psychological or psychiatric disorders. And they might include under that topic, again, a little content on problems caused by problematic use of substances. And then under toxicology, The contents are basically focused on poisoning, overdoses, but more likely from a clinical treatment approach. And the majority of plans of study of medicine, nursing, and psychology have of subjects, mental health, psychiatry, clinical psychiatry, and there, as part of their contents of those subjects, you could find pharmacodependencies, addictions, or drug addictions, but no more than that. Now we can go to the next one, please. And those are the numbers that I found. I guess not much to point out there, just to say that approximately half of the programs, the existing programs, according to this review, have subjects like pharmacology, toxicology, especially in nursing and medicine, which does not happen in psychology, and neither happen in social work. So next one, and then we're going to the, so we're saying that we have no continuous systematic education program for professionals in drug demand production, for which reason the implementation of UTC, UPC fills up an important gap in providing substance abuse treatment prevention training. So what is we have been doing in terms of that? Go to the next, please. We are now in stage 4. Stage 1. Stage 1, we did all the negotiation and the walkthrough, the first part. And stage 2, the second part of walkthrough and the UPC training. Stage 3, we got some professionals that did the walkthrough, the international certification, to the ICAP 1 accreditation. We have 15 professionals that took the exam. And stage 4, where we are now, and there's a sign that we are here, as you can see, so that we can locate it there. There's an implementation of courses, which are in the next slide. This is what we know we're doing right now in terms of courses that have been implemented, other planned for 2020 for this year. We have one in Itapúa. We have been done at the Universidad Católica Itapúa. It's a certification program. The first cohort ended in November with 29 participants. There's also a program in UTIC, the other university, started in August 2018, and I guess it's ending in March 2020. It's also a certification program, and they're having their first cohort soon ended. From the third university, we have no information available. There's also plans that we're going to be implementing a certification program at the Universidad Católica in another city, in a border city with Brazil, and in the School of Health Sciences and Medicine in April, same program. Can move. And this is a sample of what we implemented at the Catholic University at the Itapúa campus with the whole curriculum with the hours, which of course you know the seminars and the number of hours, completing 224 hours. So in conclusion, now we're getting to the end. In terms of general conclusions or specific that we have first, we verify an absence of contents related to addictions, demand reduction of substance abuse disorder, absence of specific subjects and contents in addiction, treatment, and prevention. We found also a general approach of medical and nursing careers, including topics as these topics of addictions, within subjects of mental health, psychiatry, in some cases in areas of forensic psychology. And another conclusion is the UTC UPC curriculum will facilitate the access of university setting to human resources sectors that work in the area of treatment and prevention, and who may not have university education, but are specifically techniques or got specific training in the work area, such as therapeutic operators. These will help us optimize and professionalize the workforce in the sectors and prioritize these technicians by granting them a university training certification, which is highly appreciated by them. So those are kind of the conclusions of the specific. And in general terms, having seen our political, socio-political, cultural, and economic reality, which is not different than other realities in Latin America, this implementation will find, or is finding, I should say now, challenges in this way. We talk a little bit over insufficient infrastructure, resources, budgetary, trained workforce, lack of accreditation. So ICU, DDR, SAC has a main important role in help and systematize implementation and evaluation of the courses, and accompany or monitor the development of the courses, but respecting the autonomy of each institution. Also taking notes of lessons learned among the countries of what it has been a good practice, best practices that could be transferred to other places. Those are some of the conclusions that I can think of. And I think the next one we can skip that. And that is just to say that previous one, please, Gary. That is just to picture and in where are the university and the programs that are involved in a series of links with institutions and international cooperation, ministries, health, children, private health services, NGOs, and all of that taking into account the social, political, economic, cultural context for the adaptations of these programs. That is what I think is important to take note. And then we can skip the following one. Skip that, and thank you for your attention. I'd like to leave a few minutes for questions or add-ins or discussions.
Diana, this is Roger. I have a quick question.
Yes, yes, Roger.
Could you describe a little bit about who the intended audience is for your courses at the universities? As I understand it, there's several universities going to be using the UTC and UPC. Are these primarily going to be undergraduate students, graduate students, or, as you had mentioned, professional certificates?
All of them. All of them. What we're doing is, at least what we're doing at a Catholic university, we're trying to address professionals that are already graduated, for postgraduate, that would like to do sort of a specialization in the area, such as psychiatrists, psychologists, doctors, general doctors, pediatricians, nurses. We also addressing the undergraduate students that are taking either their last year or their fourth year in psychology classes, that could take those as optional seminars and get some training in specific area. We also are offering the course to other technicians, as you well mentioned, technicians and operators, people who are working in therapeutic centers, therapeutic communities that might not have in the past the opportunity to do a formal training. So we're also addressing those. Don't know if I did I answer you?
One last question. How are you getting the word out about the programs that you're offering in addiction treatment and prevention? How are you marketing and trying to engage people in the academic programs?
Well, we're doing it using the internal ways of communicating with the students and with the community. Most likely the University of Itapúa that did the first certification program did a wide campaign of publicizing in social media and the regular media the program, because it has to be said too that that program really was successful because there was a department prevention program. They have a drug reduction program that it was part of a general plan that they were looking at as a department. The government of department had an initiative of putting together some social actors, and they called the university saying, we need you to provide us with training. And there was also the municipality, the church, and other agencies that worked together for that department plan.
Great, thank you. I think we want to open it up for questions from anyone. And if you'd like to talk on the webinar, you can unmute your microphone and ask any questions you'd like to for Diana and our other presenters.
Or if you are not comfortable asking something on the webinar, you're welcome to put it in the group chat and I can ask it of our presenter as well.
You'll need to unmute your microphone.
Right. Or maybe Cecilia or Graciela may want to add something. I don't know if you want to add something or.
Hello?
Hello.
Yes.
Good question.
Yeah, hello everybody. Let me start by introducing myself. Am I audible? Am I audible?
We can hear you, but it seems like the sound is getting cut and I can barely hear you.
You may have to speak up.
Maybe
Well, I could hear you well.
Hello?
Hello?
Okay, let me turn off my video. That may help. Is it better now?
Yes.
Yeah, we hear you better.
So,
Yes, I can hear you better.
okay, yeah, my name is Ehigiato. Let me introduce myself. I'm a senior lecturer in the Department of Mental Health, University of Benin, Nigeria. I want to just say that the situation in Paraguay not too different from what obtains in Nigeria. For example, talking about the most commonly used illicit substance being alcohol, the most commonly used illicit substance being cannabis. But I find some other part surprising, you know, talking about now in Paraguay, you have a higher concentration of manpower that deals with addiction in the private sector. And then number two, you have several private universities. This is a major difference between Paraguay and Nigeria. So I want to ask the presenter, it would appear as if the government of Paraguay is not interested or is not investing in health, is not also investing in education. Is this the case? I want to be clarified. But I'd like to go on and say that another area of similarity between Paraguay and Nigeria is the fact that there is no university in Nigeria that offers any program, whether undergraduate or postgraduate, with regards to addiction. Now, but last year, some form of training started in Nigeria with regards to UTC and UPC, and all the programs are being undertaken in psychiatric hospitals across the country. There is no university in Nigeria that is doing any form of training, with regards to UTC and the UPC. These are my points at the moment. I'm happy to have joined this webinar, and I have benefited immensely. Thank you.
Thank you. I'm not sure I got all of your questions. I think I'll see if I got them all. You said there's a similarity in terms of drug prevalence and use between Paraguay and Nigeria, which, yeah, okay, I got that. And then you also ask if there is any investment in education. Is that correct? I'm not sure if that was your questions. If there's an investment in education in terms of supporting these programs, was that the question, Theodore?
Yeah, the question is, your government is not investing or appears not to be interested in education and health, because most of your universities are private universities.
Right.
They are not public universities.
Right.
In Nigeria, most universities are public universities. You have more concentration of health manpower, in public hospitals in Nigeria. But that appears not to be the case in Paraguay.
Right. Okay. Yes, I agree with you. That is one of the challenges that we have, to include the public universities among or to join the ICU DDR and get them as educational trainers as well. Because so far only private universities are part of the consortium and are part of the education providers, which is a sample of how the investment in public education is low in our country. And unfortunately, I'm glad in Nigeria is different, but for us, that is the case, unfortunately. But yes, there is a challenge there, absolutely.
Deanna, one question from Albert is, do you plan to train non-university tertiary level students?
Well, yes, but it's all part of the same program. What we're planning to do, because there aren't that many candidates, I would say, to take the courses. So what we're planning to do is do one big group, one large group, like the first cohort that we finished in Itapúa. There were graduate professionals, and there were also postgraduate professionals, and there were technicians. They were all in the same group. That is probably going to be the case for this for the following months too, until we get more precise in terms of where are the people that will like to take the course and will involve in these courses. That's why I'm doing this review and the degrees and the careers and what they're doing and how they're doing it, to have a sense of where do we have to point out what kind of programs do we need to offer. Maybe we need to offer in the future, differentiate programs for tertiary education, non-university, for non-university students, and others for postgraduate students. So, but that is coming along the way. Now, at this moment, we have them all in the same group.
Okay. Next, we have a comment or a question, I'm not sure, from Arthur. Arthur, if you could unmute yourself. Oh, there you go. Okay, you have the floor.
First of all, say thank you to Diana and to our colleagues from Paraguay for sharing their experience. I am a student at the University of Miami, but I'm originally from Brazil, so I'm you guys' neighbor. And I just wanted to share a little bit of my perspective of something that's been happening in Brazil and make that into a question about what you guys are expecting will happen in Paraguay. So we have observed that with the change in our administration, a lot of the investment of the funds that are intended to go to prevention have been directed to supporting therapeutic communities, rehab centers, which a lot of the times are not well equipped to help prevent or treat substance use issues. They're oftentimes associated with political interess. And there have been a number of reports of maltreatment and actually doing more harm than good. What we have also observed is that the interest of our politicians in getting people, professionals certified or go through courses so they can provide evidence-based, in quotation marks, treatment or prevention really is just, again, making sure that the people they want to fund have, like a little diploma or certificate saying that they can do the work that they do. So all of that is to ask, do you guys expect any political pressure for providing the certification to these handpicked people who a lot of the time are not equipped, do not have the skill set to deliver evidence-based prevention or treatment? And if you're expecting that to happen, what is the strategy for making sure that actually the people who do need to go through these trainings, who do need to be not capacitated, but need to be trained, they need to be have like the certificate, need certification, how do you make sure that they are going to get access instead of just the hand-picked few?
Well, that is a great question. I don't know the answer to it. I think there are a few ideas that I have, but no, we don't have a plan on that. There's more thinking and planning and conclusions are being done in the prevention team that is working, because we are planning to work with the Ministry of Education and working with the teachers at the teachers of the public schools and get a little bit of pressure there that teachers should be trained and try to get for that area, more for prevention than for treatment. But no, we don't have a strategy as of now. And it probably has to do with the political and social and cultural situation as well. Universities, those private universities that I mentioned, many of them are owned by political entrepreneurs or business people, and so it's difficult to negotiate in terms of the needs and the needs of they will say something like the needs of the market, quotes, which is not our main goal. We don't look at the market, but we have to in a certain way. But we need what is people needing, what are the needs of the population and educational training opportunities. So we have two different speeches. That's what I see. So we have two different views. That you are absolutely right. I completely agree with you. We have to somehow synthesize and try to articulate our speeches, our views, political, economical, the needs, and educational. To make this happen in a better way, in a more structured plan. But we're not there yet, unfortunately.
We probably have time for one more. other people have questions, they could certainly send them to me and I can ask Deanna if she's willing to respond later. But I see Dr. D has his hand raised to ask a question, so you just need to unmute.
Dr. D.
I'm Dr. Eugene Dodoy from Ghana.
Welcome.
Hello?
Hello.
We can hear you.
Yeah.
You have a
Yeah.
question?
Okay, great. So I am a psychiatrist in Ghana, and I did a Hubert Humphrey program on drug abuse epidemiology. And back home in Ghana, I would want us to be able to train psychiatrists who will become more like addiction experts or addiction psychiatrists to help treat persons with addiction. So this is likely to come in the postgraduate medical college. So I wanted to know whether, the UTC program can help, probably with some fellowship programs in the US. And then secondly, at our last meeting in Ethiopia, it was agreed upon that we're going to get a curriculum for a master's in addiction psychology. And I'm yet to hear a bit about that.
I'm not sure that question is for me. That's for somebody else, right? Because it has to do with ICU-DDR, right?
Yes.
Dr. D? Yeah. Yeah.
Yes.
So
We can certainly discuss that if you want to contact me. We can just finish up today and I'd be happy to discuss that with you more. I assume you're talking about the meeting with Dr. Kadar in Ethiopia, so she would be a good contact for that as well. But that being said, I want to thank our presenter and her colleagues. And Deanna, is there anything you want to say before we close up?
I just want to thank you, everybody, for the patience you have. You have been really patient. You have been really nice in this presentation. That was my first presentation by this means, so I was a little tense and it was a little too long. And so I want to thank you, everybody, for listening and for sharing and for your thoughtful questions and concerns that brings a whole new perspective on how we're working and how we're doing. And I think this was the intended, the motivation of this webinar. So thank you, everybody, and we'll see you around.
And if anyone missed anything or wants to rewatch it, it will be posted on our ICU-DDR YouTube channel, and I'll send out the link for that as well. So thank you again.
Good presentation.
Thank you, Dr. D.
Thank you, guys. Thank you so much.
Thank you, Arthur.
All right. Take care, everyone.
Take care. Bye-bye. Have a good weekend.
You too.